Hello and welcome to Our Experts Podcast. I am Carol Matichka, your host, bringing you fascinating perspectives from the world and realm of pharmacy. Well, hello, everyone. We are very fortunate today to have with us Dr. Eric Larson, who is the current president for the Florida Pharmacy Association. He's also an independent pharmacy owner. So I just want to say thank you for all that you do. You truly are a pharmacy champion. And thank you for being with us today.
Well, I really appreciate y'all having me today. And thank you, Carol, for hosting me on the show. Looking forward to a good conversation.
Absolutely. So why don't you give us a little bit of background about yourself? What brought you to pharmacy? How'd you become a pharmacist?
Yeah, so it's an interesting story. Really, ownership's an interesting story. But as a pharmacy, I really want to go to dental school. Ironically, when I graduated from high school, I got my bachelor's in biochemistry from Stetson University, a small private school in Florida. And then I started doing some internships in dental offices, orthodontics, things like that. And I realized that I like the chemistry component a little, more than I thought I would like, dentistry and work with people's mouth and blood wasn't part of what I really liked after a while. Then I kind of stumbled upon pharmacy when I was doing my senior research project on alcohol dehydrogenase, right, which is an enzyme that breaks down alcohol. And I realized at that point, like I really love the metabolic pathways and the way the body works and, how drugs and stuff, started operating, throughout the human body. So then I kind of, again, started, looking around and realized that I can get a good feel of the chemistry component. I wanted to go into research, and then I realized that I really enjoyed being around people too much. And making an impact in the community. So being in community pharmacy was really my sweet spot. So I went to pharmacy school at Nova Southeastern, graduated there in 2007, and became, started working in the community pharmacy setting in a chain pharmacy, got a feel for the industry, and then, moved on to independent from there in a bunch of different types of pharmacy and learning.
Oh,
So,
that's great.
yeah, no, it's been a great journey, and it's proof of you got to find what you don't want to do in
Yeah,
order to find what's best fit for you in your life.
absolutely. And we'll have to talk offline at some point. My son just started at Stetson this fall. He's
Oh
he's
yeah,
a freshman there. Yeah. So
Hatters.
go Hatters. There you go.
Yeah,
So when did owning a pharmacy become what your next goal was in life?
Yeah,
How did that
so
come about?
I've always had a business entrepreneurial type, I guess, perspective on life or ambition, I should say. Uh, Ever since I really got into school. I took leadership positions in undergrad, um, student government, all that stuff. So I was always involved, student business, as well as I took business classes because I was really interested in the economics component of any type of business, whether it's pharmacy or whatever I was going to get into. So I've always had that drive. And then when I got into pharmacy school, interestingly enough, I started working at a chain pharmacy, Walgreens, and I did not work in the pharmacy as a pharmacy student, believe it or not. I worked most of my shifts as an EXA, is what they called it. It was like an assistant manager. And the reason why was I was really attracted to the operations and the finances and running the store. So that really turned me on to, wow, I guess you can have the clinical piece and the business aspect all in one. So I would do like a shift in the pharmacy, and then I would work, out front in the pharmacy. I did photo, cash, I learned cosmetics, everything. So um, really interesting blend. And that's when I realized, man, like I really feel like, owning and operating or managing was something that was in my wheelhouse. And then when I got out, on rotations, I worked for an independent. Um, he basically hired me out of school, 6 months out for graduation, said, hey, can you come operate my store, manage it? And then from there, it was just kind of a snowball effect. We opened a new store together. I built it, designed it, and then started working in other independents. And then, after a while, you realize that, corporate and you want to be your own boss, I guess, for lack
Yeah.
of better terms, was kind of where I wanted to be and make my own decisions, whether for good or for bad. And, the rest is history from there.
Yeah. Oh, that's fascinating. Tell us a little bit about your pharmacy.
Yeah, so we have 3 locations right now. We're going to be opening 2 more in the next year. So we're really excited about that. When I first bought the pharmacy, which is in St. Cloud, Prescriptions Unlimited, the original one, it's been around since 1977. I bought it in 2017. And we have a very unique, when I first bought it, actually, it was, a middle of the road volume wise, but been there for 50 years. Really good establishment. The longest standing independently owned pharmacy in Osceola County, still is, obviously, because we're open. And we just kind of grew it from there into transitions of care. We do outpatient services for the hospitals in our area, specialty meds, compounding. Really, I work to diversify our business model so we're not stuck to the traditional dispensing that we do now. We do clinical trials, adherence programs with payers, Medicaid contracts, all kinds of different stuff that kind of differentiates us from the traditional community pharmacy. And that's why we've been successful. And that's when we've been able to expand. I bought another pharmacy, ironically, in Sanford, where I'm from. And it's the pharmacy I worked at when I was in high school in 1999.
Wow.
The owners called me up and said, Eric, do you want to buy the store? I want to keep that tradition going. They've been there for 50 years. And when I bought the store, some of the employees that worked with me when I was in high school are still there today. So that was kind of a fun and unique type of relationship change from when I was 17 and now, being an owner.
Right.
So that's been great. And then our newest model is, and this is what we're really excited about, we are the first pharmacy independently owned to contract with the municipality or a school district. So we have a pharmacy inside the Osceola County School District's health center for their employees. And it's a niche market just for them. They get, their copays on generics are zero. They get all kind of cost concessions to help mitigate costs to the patient. And it's also saved the district. To date, we've been there for almost 3 years. We're over about 1.2 million in savings.
Wow.
With our cost plus contract. We eliminated the PBMs and went direct with the school district with a cost plus dispensing fee model. And that's why we're opening 2 new locations. They're building us 2 new locations in 2026. So we're super excited about that.
Yeah, that's all fascinating. Thank you for sharing that. Maybe in another podcast we'll delve into that. So I know that this is taking up some of your precious time. You're extremely busy, especially now that you've taken on the leadership role as well with the FPA. So tell us a little bit about, how you got to this point with the FPA and what drove you to be a part of the leadership like you are.
Yeah, no, I started really getting involved with FPA when I became an owner, so that's about almost 10 years now, 9 years. And, I started off just being involved, being a member, attending meetings, meeting leadership, joining committees and councils, in those infancy stages of trying to get involved and help advocate for our profession. I think that's the key when it comes to, obviously owning a business or trying to make sure that the preservation of our profession and the expansion really of practice. So I started off there, and then I, ran for, Speaker of the House of Delegates. So I won that election process and kind of progressed from there. I've always I was the chair of the Government Affairs Committee multiple times now. So I really start off because I love advocacy and government affairs and legislation. That's really been a passion of mine for a long time. So, at that point, I thought maybe that, I was asked actually by previous leadership to run for president. It wasn't something that I had coveted or something that I was looking into. But, it fits in my model or my sweet spot, I should say, because I enjoy the advocacy piece. That's really what FPA is built around. I love conversing with members, colleagues, collaboration, all those things. So, that's kind of where I was like, okay, I definitely, if there's value for me to be there, then I'll do it. Right. If I feel like I can bring some value to the association, the profession in general, then I'm always on board to do that, whatever position it is. It doesn't need to be president or treasurer, whatever it may be. If there's value that I can bring, then I will, obviously serve in that capacity.
That's great. And speaking of which, what is your vision then this year for the FPA? What would you like to see?
Yeah. So what we're really focused on is engagement of membership. Our council and committees are going to be, they're going to be very active this year. We're really taking seriously the resolutions from the House, the initiatives, and we're going to be putting forth a lot of action items, I guess. So I guess if I had a coin term, it'd be, action based. So every committee is going to have an action item, even our board, our president's committee, everything is going to have some type of piece to take away from meetings to implement to help keep growing what we're doing. So the foundation's been there forever for the Florida Pharmacy Association, as you may know, but now it's really starting to find out what we're missing and listen to the members and listen to the pharmacists in the state of Florida, and then implement what we can do to help their careers better and help expand the practice, right? So we're super focused on, obviously legislation and helping out the independents and the chain pharmacies with their reimbursement model. We want practice expansion. We want payment for services for our outpatient pharmacies, for every type of pharmacy. The hardest part with FPA is we represent everyone. So there's a lot of different ideas and a lot of different specialties within the pharmacy space that we're trying to address. So I'm trying to touch on, every type of pharmacist out there. And then also we're trying to really embrace the collaboration with FSHP too. I think that's another big part of my mission, is to make sure that we're really collaborating. We have joint councils and committees now. I've added a lot of their members to our committees and really get that collaboration going more so than ever. I think that's important, that we have one voice and that we know and we're on the same page, right? I think that's the important piece. Communication between associations, between our members, is going to be a huge part of what we do. You're going to see a lot of stuff going out to members from the office in emails, social media posts, and things like that as well.
I think that's great. I was just talking to a pharmacist the other day who mentioned, FPA, you talked to us about FPA, but, and of course I talk about FSHP too, but they say, well, why would I belong to FPA? I'm in academia or I'm a hospital pharmacist, and explaining to them that really the FPA is for any pharmacist and has been around for many, many decades in that capacity. But I think that is one of the challenges for the FPA.
Well, and you should be a member of both.
Absolutely,
to be honest.
you should.
And
that's
no
one
doubt
of the
about
things
it.
I've said as well. And one of the other questions that was brought up, and I'm putting you on the spot here, but was, well, then why don't we just combine the two? And I don't know if that's something that you've heard or anybody's talked about. I've heard it over the years here and there, but not sure if that's something that's been taken seriously or not.
There hasn't been really many discussions on doing so. I think initially we just work on collaborating. I don't think that has to happen. I mean, having one association, one organization represent all pharmacies would be phenomenal. However, I take, for example, nurse practitioners is a good example. APRNs have their own associations, CRNAs do. There's just a lot of different subspecialties and a lot of different focuses. I like having FSHP and I like having FPA. Whether it's on one umbrella or not is irrelevant to me, right? Everyone should be a member of both. And as long as we're advocating together and we're collaborating, it really shouldn't matter whether it's the same association or not. Because as long as we go to Tallahassee, for example, with one message, or every idea that we have amongst both associations, we're trying to execute for the betterment of pharmacists, wherever it may be, it doesn't matter to me as long as we're keeping that communication line open. But the combination piece, I haven't gotten that. I've only been president for a month and a half.
Right.
I'm just focused on right now making sure that we're collaborating amongst everyone, whether they're a member of FSHP, FPA, or not a member at all, right? And bringing them in-house into our association so they're active.
Right. And I would agree completely that I think FSHP and FPA has done a really good job in recent years, too, of collaborating really well. And so keeping that momentum going, I think, is great. And then what are some events or anything you want to share in
Yeah.
regards to what the FPA has that's coming up in the near future?
Yeah, so a couple things going on right now. I'm personally running a campaign to visit all the schools, as many as I possibly can, to discuss what our plans are and kind of give that message out to all the colleges of pharmacy all over the state. I've already visited Orlando. I'm going to be visiting Gainesville campus, excuse me, on October 30th, and then visiting the other schools as the end of 2025 comes up and into 2026. So that's a
And don't
personal goal
forget
of mine, was to
Jacksonville.
have better outreach. Yeah, yeah. We're working on each one. So
Yeah, no,
within the
that's
FPA
fine.
office, we're trying to schedule each campus,
Right.
whether it's with the NCPA division or the student body in general, doesn't matter to me. And we'll be sharing what we're doing, in our initiative. So
Great.
I encourage all schools to reach out to the FPA office or me directly, and we'll start scheduling those visits for sure. So that's been a big push. We're also using our regional directors are going to be extremely active, and they've been so good in the first 45 days or so, where they're actually going to be attending schools and attending events themselves and
Great.
speaking on the behalf of FPA, which is excellent. It's one thing for me to go
Yeah.
around and just talk to everyone, but knowing someone that's in your area,
Yeah.
maybe practices down the street from you, having that outreach is critical. I think it's not just one person, it should be a team. And our board is extremely active and working in that capacity right now. Um, we also have our headline legislative days, January 28th and 29th in Tallahassee.
Yep.
Again, like I mentioned earlier with FSHP, we're working real tight with them on making sure that we're getting everyone and the schools as well, everyone at that legislative days event, not just the students, but we need to get pharmacists there too. Not only do
Agree.
they have to go with the students, but they need to go experience it themselves if they haven't before.
Yeah.
It's a different type of messaging. It's a different type of conversation than what you've had in your district or just with someone casually in your region. So
Right.
that's a big event, and then obviously the annual conference in July. Um, Next year is our big push. But
I
we also have
wholeheartedly agree.
we're having a regulatory conference in Miami coming up in December
Hmm.
too, which should be a really excellent event. So just basically just,
Fantastic.
stay tuned to the calendar as FPA adds events. But our calendar is updated with our big ones right now.
Great. Perfect. Thank you. And you're extremely involved legislatively. I mean, that was one of the reasons I think you became involved with FPA as well, is, you really enjoy it and you do a great job for our profession. So thank you for that. So what is currently going on nationally that FPA is really helping in regards to advocating for?
Nationally is really interesting right now. There's been a lot of movement on the PBM legislation nationally. There's a handful of bills out there, regulating PBMs. The health insurance pharmacy benefits is really under a lot of scrutiny right now. As we all know, it's
Hmm.
pretty obvious that there's a lot of different things coming through federally in regards to medical spend overall.
Right.
So I think that's another piece. Prior authorizations, there's a lot of different small parts too that may or may not be added into some type of bill in the future. But we're hoping for a payment reform, I guess would be
Hmm.
a coin term, to help with, and it's not just in pharmacy space. The medical spend and the health spend is kind of, you know, I don't want to say, out of control, but it's just something that they're looking to tighten up as the budgeting process goes through. But really, and then as always, APHA and all those federal NCPA, ASHP, they're always pushing forth. Provider status, is always something that we're pushing for.
Right.
And, we can get into that. We're working on that at the state level as well, which is awesome.
Yeah.
But as far as federally goes, there, those large or, our national organizations are really doing a good job trying to push forth some legislation that helps pharmacists out and proves that we're already doing a lot of these things, and we can do more to help the entire health system with just some tweaks to the current laws in our scope of practice.
Sure. I mean, pharmacists were the most accessible. Healthcare
Yep.
providers were right there. Just need to
Yep.
utilize us a little bit more. So you mentioned the
Sure.
state. and provider status. Share with us a little bit about that because that's really interesting.
Yeah. So I can't share too much because we're working on our
Oh,
bill
that's
language right
fine.
now. And I don't know what that's shaken out to be, but our goals this year are really to, it's basically a payment for services,
Mhm.
whether we get provider status or not. Like I mentioned a few moments ago, we're already providing a lot of clinical
Right.
services right now, just in our basic day-to-day practice. So, and we can really do more and impact the overall spend in the health system in the state of Florida, for example, by just utilizing us and expanding what we can do. Our Practice Act is dated, right?
Yeah.
We are doing way more than what the current Practice Act and the statutes allow us to do, as we've been piecewising, test and treat, immunizations, all those different things. We haven't really gone back to the Practice Act and worked with the Board of Pharmacy and the state to fix that. So we're looking to do that and add a payment for services, um, which is kind of that. I don't want to use provider status because that's tough, but it gives us an
Right.
opportunity to contract with a medical plan, for example, and get paid for those services, which is huge.
Yeah.
Especially if they can, if the health plan sees value in what we're doing and can save on the total spend. If we could prevent one, ER visit or a hospitalization, the amount of money that they would spend for a pharmacist to have that intervention is so minimal compared to what those admissions and what that overall cost would be if we could prevent that through medication adherence or through a test and treat protocol or collaborative practice agreement, for example.
Sure.
So a lot of those things are all in play right now, but that's one of our big focuses this session.
No, that's great. I know the students are very excited about all of the opportunities that I feel are just at our fingertips at this point and being able to really provide patients with the very best care. And like you said, save a lot of dollars in the meantime as well.
Yeah, when you're going through legislation, it all comes down to budget.
Mhm.
When you can show your value and it impacts the budget positively, it really resonates, with legislators and with the state. And that's what I mean, that's literally what I did with the school district, for example, to go back to that. I said
Mhm.
I can provide the same and better service for less money.
Yeah.
And that always worked out for me, and it works out when you have that type of conversation with the legislation or with the legislators and their teams and their
Absolutely.
staffers. But
And
it's
when
really
you
tough to do.
It can be,
It's
but you have to bring in money into the picture. I mean, that's just a part of the conversation, but if you think about it, when you're saving money, that means people are doing better because they're not having those hospitalizations. There aren't
right.
these additional costs that are being created. So, um, have to talk about money when we're talking about patient care because ultimately they are hand in hand. So,
And better care doesn't always cost a lot more money, right?
that's what
That's
I'm
the
saying,
key.
yeah, and you're saving
Exactly.
money in in the long run for these patients who,
Yeah.
have better outcomes, so absolutely.
Exactly. Better quality of life, better outcomes. They're
Right,
not visiting the hospital all the time. Yeah, there's a lot of different pieces.
right.
When our talking points always address better care.
Sure, hand in hand, yep. Well, thank you for that, and then, what can pharmacists who are listening, pharmacy students, whoever might be listening, what can they do to help in regards to pushing pharmacy forward this year?
Yeah. So again, I'm going back to the advocacy part. First is to get involved.
Yeah,
Join the association, join both associations. As a student, the costs are nominal, as we
right.
all know,
Cup of coffee a
and
year.
that's by design. Yeah,
Cup of
exactly.
coffee a year.
Um, and get involved. Um, if you don't, show interest in getting involved with counseling committees. If you're not assigned to one, it's not because we don't need you. Like, I always like to go back to, you're always needed, everyone is, in whatever capacity you can contribute. Some people don't like to talk to legislators. I have a lot of
Mhm.
my colleagues like, hey man, like I don't really want to go to Tallahassee and do that. Like, it's very awkward for me. I'm like, well, that's fine. Show me your membership, give money to the FPPC, help us out in other avenues and find what works for you, as everyone in the association does. And it works out really well when if you're really motivated and you're comfortable with those things, then you will be, active, and we'll find a way to get you involved in that role. Especially as a student, it's wonderful. The grassroots is huge when it comes to legislative session coming up here in January. Meeting with legislators, talking, discussing our talking points, showing your value to the community is huge. And obviously, being involved with your school associations, your student chapters of whatever it may be. Like I said, NCPA, FSHP, all those student chapters, ASHP, whatever you have, APHA chapters. We're starting FPA chapters at the schools too, which is really exciting stuff, which we should have launching in the next couple months too. So,
Great.
being involved with your student chapters is very critical because you'll get messaging as well coming from the state associations.
Yeah, and one of the things I always point out is, sure, the money from the membership helps towards lobbying and supporting the profession, but also in the end, it's numbers as well. So when we go and we
Right.
speak to legislators, it's very important that they see that we have this strong voice. So, and I agree, it doesn't mean you have to go to Tallahassee, but you just being a member and supporting is absolutely huge. So, thank you for sharing that. And then, is there anything new you want to share in regards to independent pharmacy practice that maybe is on the horizon?
Yeah, as we push forward with a lot of our legislation, we're looking to enhance community, independent outpatient, all those types of settings as well. I think in the independent space, what we're excited about is the clinical services piece, which is huge. A1C testing. We have a contract Medicaid right now for A1C testing. Outcomes, medication management with managed care programs in the state of Florida and the Medicaid program to help save money, to the Medicaid program in general, which, as we know, is always beneficial.
Sure.
We're really excited about that. Clinical trials is a huge part of what we do now, which is really exciting too, as those ramp up. And, long acting antipsychotic injections, really just kind of giving that community outreach. Traditionally, independent pharmacy owners have more time, or independent pharmacists, I should say, and our staff have more time than a traditional chain, and certainly a mail order, because their relationship with the patient is through the phone or a FaceTime, whatever that may be. So really getting more hands-on with the clinical pieces, and having those interventions with patients, and discussions through, as we've always done, MTMs and things like that, but really taking the MTMs to the next level, where it's, like I mentioned, A1C testing, immunizations is always a big push, discussing, diabetes programs, all those different types of things, and then contracting with plan sponsors to do that.
That's great. Exciting. All right. Like you said, it's flu season, so immunizations.
Yep. Yeah.
So before we end, is there anything else, Dr. Larson, you would like to share with our listeners today?
No, I think we touched on everything. If there's one message, is again going back to the FPA and state associations and active, really get involved. I can't plea enough, and I'll be sending out like a presidential message, I guess, to everyone in the state here in the next, hopefully next couple weeks. Really getting in more involvement, as we know, and as you mentioned, Carol, it's super important. The finances of the FPPC, which is our political action committee,
Mhm.
is huge, but grassroots and discussions and members being active is far more important than any dollar.
Yeah.
Um, because the voices and the communication and the relationships with legislators is critical. So if there's one thing I ask, is reach out to your local legislator, whatever you're at, wherever you are in the state of Florida, build a relationship with them, be an outlet, because they get calls from constituents all the time saying, "Hey, my drugs are too expensive. I don't know why my insurance doesn't cover this." Pharmacists, we have that intricate knowledge. We can see it real time at our point of sale when we're running claims or when we're working in the pharmacy space. We know formularies. We can see all those things, and being an outlet to them and a resource to a legislator and to all your community members is critical. And that's real advocacy. Real advocacy is being an outlet and building a relationship and servicing your community, being community first, and really joining your local, community associations as well. And just, having that relationship with anyone in the area and showing your value. That's probably the number one message. And that's how I was successful. I started out working my city council, worked out with my school board, the chamber of commerce, all those things.
Yeah.
And you don't have to be an owner to do that.
Right.
You can be a pharmacist in a chain, any setting, to get active in your community.
Those were all great points. Totally agree. Advocacy isn't just going to Tallahassee, and it's really just advocating everywhere you are in regards to our profession, and advocating for your patients on top of that. So, well, this was fantastic. I just want to thank you for coming on, Dr. Larson. We really appreciate your time and all that you do for the profession. It's a difficult and challenging task to take on a presidency. So much that people don't realize is involved with that. So thank you for doing that. We really, really appreciate it.
No, of course. Again, if I can bring value, then I'll serve. It is a lot of work. I'm not going to lie. You were right about that. But it's worth it for the long run, for our students, for the future, and for the present.
Well, thank you. Absolutely. Well, we want to thank Dr. Larson for taking the time today to meet with us. And don't forget to subscribe to the podcast and the YouTube channel. Take care, everyone.